Let's talk about surgical facelift and neck lift. So that's the procedure that everybody obviously heard of and seen. There are many different ways to do it, but the most common way that I do it is basically, usually when I talk about facelift, it's a lower facelift. It goes this way and it pulls the neck. So it's lower facelift and neck lift. During the procedure, we don't just pull the skin, because skin will just stretch right again, and then you're back to square one. We're actually pulling the muscle on inside. So yes, we take the scar that goes kind of through your hairline and around your ear and hides behind your ear and back on the hairline. That gives enough movement around here to pull all this tissue and the skin of the neck back up there. But again, before we just cut the skin off, we actually have to secure your muscle to make sure that goes where it needs to be. Skin will get just draped right over it, and excess skin will be removed. At the same time, I usually do liposuction of the neck. So if there is extra tissue underneath the chin, that will get sucked out. We also put muscles together right here. It's called Platysmaplasty. Platysma is the muscle that actually goes all into your neck. So if I make it like this to demonstrate, this is the lines that created by platysma muscle. When they're too prominent, we sometimes put Botox in it, and I have videos of that on my social media. But these two muscles usually create the separation right here, and during platysmaplasty, we'll put it back together and then drape the skin over that as well. So platysmaplasty, neck lift, and lower facelift is usually what we do when we're talking about facelift, neck lift. Who will benefit from that? Well, anybody who has enough laxity that I feel like maybe too much for my face tight procedure. I always prefer to do face tight first if I can. One, it improves your skin quality and texture. It improves your elasticity. So even if you come back and do facelift later on after face tight, that's okay too. But for most of my patients, I prefer to either do one, face tight, neck tight, or if I'll say, nope, too much skin, we gotta do something else here, I would combine the two. I still do face tight because I like to increase that elasticity and have extra tightening of the tissues, and then I do facelift at the same time. Facelift takes a little bit longer, takes a couple of hours to do. You can either go to sleep under general anesthesia, or it can be done awake with sedation. So you get some pills to make you very calm and sedated, some pain pills, and you just kind of hang out while, again, I numb everything up and I do the procedure. It's pretty easily tolerated. For this procedure, I definitely do not do it on smokers. I want people to be smoke-free because of the healing issues. We hide our incisions very well right inside the ear, so by the time you heal, and as long as you don't keloid, right, we have to make sure we choose the right patient for it. Once the scar is very thin, then it's very hard to tell you had anything done. Of course, some people just cover it up with their hair, but I prefer to make sure my scar is done in a way that even if you had your hair open, it's very hard to tell you had anything done. Recovery is a little bit longer. There could be a little bit of bruising. You do have kind of dressing on when you leave from here, so you will be wrapped up. You kind of go straight home when you're done. It is an outpatient procedure. I usually bring you back 24 hours after to see you, and then as usual about a week out and 3 weeks out and so on, to make sure everything's healing well and going the way it's supposed to go. Other procedures that can be combined with facelifts are blepharoplasty. That's when we minimize amount of tissue around your eyes. If you have hooded eyelids or under eye bags, it can be combined with either surgical or non-surgical blepharoplasty. Everybody's a little different, and when you come on consultation, that's when you can decide, okay, do I just need lower facelift and neck lift? Do I need to combine it with blepharoplasty, surgical or non-surgical? Do I need to add other things like fillers and Botox to rejuvenate rest of the face? If you have any more questions, of course, write your suggestions here, email us, come for consultation, do telemedicine consultation. This is one of the popular ways we meet our patients nowadays, and we can discuss different options to get you started. And if you have any further questions, just call us. Thank you.